Hello and welcome to the live press conference on the COVID-19 situation. I am Fennel Neptune. Over the past couple of days, Saint Lucia has noted an increase in COVID-19 cases, and this situation, of course, affects the country. Today, we have with us the panel. We have the Chief Medical Officer, Dr. Sharon Belmar-George, the National Epidemiologist, Dr. Michel Fassois, and the National Immunization Manager, Tekla Jabatis, to speak with us on the COVID-19 situation. So we have Dr. Fassois who will be speaking about the epi situation, and we have Dr. Belmar who will be speaking on the variants of concern, given that we have the possible introduction of variant in Saint Lucia. And we also have Nurse Jabatis who will be speaking on the vaccination status in Saint Lucia. This press conference is being streamed live on the Government of Saint Lucia's Facebook page and also the YouTube channel, and it's also live on NTN. We will first have a quick discussion by the panel, and after we'll take a few questions from the media. Bienvenue à ce conférence média à ce situation COVID-19. Ces jours qui passent, nous voyons qu'il a tenu haussement un case COVID-19 à Saint Lucia. Et puis, aujourd'hui, nous avons même office santé qui a situation ça là. Vous savez, conférence ça là à son page Facebook et channel YouTube gouvernement CC et à son station NTN. First, we will start off with the Chief Medical Officer, Dr. Sharon Belmar-George, who will give us a quick overview.
Thank you very much, Ms. Neptune. Good morning to all. As everyone is aware right now, we have been managing a new wave of COVID-19 in country. Over the last 14 days, we've noted a total of 497 cases within that period. Our national epidemiologist will go into the details of the cases. Public is aware where the cases are coming from, and also the distribution, the age groups, and also the increases that we are seeing in COVID deaths and COVID-related deaths. We thought it necessary, based on the increases that we are noting, to give an update to the public, both on COVID-19 and also our immunization status. We have been monitoring the transmission rate of COVID-19 cases over the last few weeks. And as we indicated at the NEMAC meeting, we saw an increase of the transmission rate, which went from 1 to 2 to 2.2, and from last week to 4. There were a number of factors that we had been monitoring. We monitor about 20 health indicators, one of them being our hospitalization rate, also the age of the persons who are affected by COVID-19. As is customary, Saint Lucia, as the rest of the region, we send the Caribbean Public Health Agency, and this agency outsources the gene sequencing process for the variants of concern. None of us in the region have the capacity in country, because it's highly technical to do gene sequencing in country. So we have received the last batch of results from the Caribbean Public Health Agency, and they've noted that we have 6 new cases of the variants of concern. Cases are the Alpha variant, and we have noted 3 new Delta cases in country. These are the first Delta variant cases that we have recorded in country. The 3 Alpha variant cases are all Saint Lucian. Now have 54, total of 54 of the Alpha variant recorded in country, and our 3 Delta variant cases, 3 are US nationals, and we have 1 Saint Lucian case. Of the 6 cases, only 1 of them is a fully vaccinated person. From the 3 Delta variants, they're all female, and they range from 18 to 37 years old. Of the 4 local cases, 3 of the 4 local cases are from the south of the island. So as we looking at our data for the last few weeks, we suspected that we may have had the Delta variant in country, and we have just received the confirmation that we do have the Delta variant in country. So as we discuss, I will be giving some more information on the implications, the preparation of our healthcare system that we have been putting in place to be able to manage the increase, and we'll also indicate what it means to the public for response, as we are now in a very critical situation given the impact that the possible impact that the Delta variant can have on us. Thank you.
Okay. Thank you very much, Dr. Belma. And just to reiterate what CMO said, that we did get some additional cases of the Alpha variant, but we got 3 new cases of the Delta variant, which is new for us in Saint Lucia. Aussi, chef officier médical, Dr. Sharon Belma George, déclaré que nous joignent 3 cases neufs du Delta variant à Saint Lucia. Right now, we move on to the national epidemiologist, Dr. Michel Passois, who will provide us a situation update for Saint Lucia.
Sorry. Thank you, Ms. Neptune. Good morning to all. This morning, Neptune indicated I will be providing a local update of the epidemic. But before I do so, I would like just to put things in context. Globally, over 198 million cases of COVID-19 has been reported, with 4.2 million deaths. And these numbers have been increasing over the last few weeks globally, with the highest incidence being from the United States of America. Regionally, we have recorded close to 1.2 million cases with approximately 15,000 deaths. And as of the week of August 3rd, there was a 6% increase in cases. Locally, what we have seen is as of August 12th, there have been 6,112 cases reported to the Ministry of Health and Wellness, which lands us at a prevalence rate of 337.3 per 10,000 persons. In the last 28 days, we have recorded 640 cases. We also have 95 deaths. Of these, 67 of them have been due to COVID or COVID-19 deaths, and 28 of them persons who have died with COVID or COVID-related deaths. Over the past 7 days, we have had 294 cases reported daily. When you look at our cases over the past 14 days, we have recorded 497 compared to the previous 30 days where we were at 143 cases. Similarly, if you look at the last month or the last 30 days, we have recorded 654 cases compared to the 271 in the previous 30 days. I will not go too much into vaccination because Nurse Shabatis, my colleague, will give a more in-depth analysis of that. However, of note is that 18% of our population have received the first dose of the vaccine, and approximately 14% are considered fully vaccinated, meaning both shots. When we look at the distribution by age and sex, we note that male and female, there isn't a significant difference in the male and female coming in with COVID-19. However, we do see that the age group 25 to 49 is the age group that is most affected, presenting with the highest number of cases, followed by the age group 50 plus. Next slide, please. When we look at age-specific rates, we continue to see the age group 25 to 49 being the most significantly affected, which is actually followed by our age group 18 to 24. So when we adjusted based on the population of the various age groups, our age group 18 to 24 is actually the second most affected age group compared to our the other age groups. We know that our children, although they do contract COVID-19, the numbers are still relatively small, and we continue to manage cases throughout with our kids. When we look at case fatality, we note that our 65 plus has been the age group that has been most significantly affected. And in these, we find that a lot of them are presenting with underlying medical illnesses, and of significance would be diabetes and hypertension. And that would not be at all surprising to us, considering we are facing challenges in Saint Lucia and worldwide with chronic non-communicable diseases such as diabetes, hypertension, cancer, etc. So we're seeing our population in terms of deaths, we're seeing that quite a few of them are appearing or are being diagnosed at that point or have underlying medical illnesses. In terms of the sex, we note that in this slide that approximately 66% of the deaths have been males. There are several reasons for that. We know health-seeking behavior of males. They tend to wait a little longer before they go in, but it is one of the things that we are noting. So we are calling on males to please, if you have signs or symptoms, please try not waiting till it's too late. Ensure that you are taking care of yourself, overall mental health, to ensure that we do not see these trends continuing. When we look at where these cases are coming from, the numbers point to Castries in terms that we have the highest number of cases from Castries. But when we do the prevalence by health district, we'll see that Babono would be the region most heavily affected, followed by Ancillary and Grosley. So these are the areas also, some of these areas that we are seeing breaches in protocols, that we are seeing many activities happening, and it is reflecting in our data. This is a distribution, next slide please, by months, just so you could see what we have been tracking. Our major outbreak had been in January to February, and in March we saw an abrupt decline in the number of cases. But I want you to focus also on August here. And we are at August, almost halfway through August, but we are at the numbers that we saw in July, midway through August. So we are expecting the numbers to continue climbing. There are several reasons. We now faced with the variants of concern. We had several activities, and it is of note that the numbers have continued to climb. We have not included the numbers for today as yet, but they are also significant. This can be more readily visualized in our epidemiological curve, where we see as of July a very steep increase in the number of cases. It demonstrates quite clearly where our peak was in January and February, but we are now heading towards a quite steep curve, if you note, and so our numbers continue to increase unless we do something to break the transmission chain. In terms of vaccine coverage by dose and age-specific groups, what we have noted is that our highest uptake has been in the age group 65 plus. If you know, they have been the ones, 39% of that age group have had the first dose, and 32% of them are considered fully vaccinated, meaning that they have received both doses of the vaccine. Our next highest uptake would have been in the age group 50 to 64 years old, and we are seeing not so significant uptakes in our younger age groups. When we look at the age-specific rates for confirmed COVID cases as well as the fully vaccinated persons, we know that our highest number of cases, and that was indicated in previous slides, are among our 25 to 49. So you see from 18 moving along the spectrum, the numbers are significant. When you look at our older age groups, the 80 plus, the 75 plus, and you look at the age-specific vaccine rate, it is quite significant. So we having, compared to the younger persons, the older persons are going in for their vaccines. We would still like more, we applaud them, but we would still like to see more persons go in for their vaccines. However, we note that the rates of COVID-19 among these older persons are less than in the younger age groups. This is just a snapshot as what we have been seeing over the last 2 weeks. As indicated, there were 497 cases confirmed in the last 2 weeks. That is between July 30th and August 12th. We note that, again, the age group 25 to 49 in terms of numbers as well as incidence is the most significant, which is followed by the age group 15 to 24. So the age group still being affected, our 25 to 49, it continues to reflect in our most recent data. When we look at health regions, however, we sort of have a shift over the last 2 weeks. We note that the health region, this last one, I'm sorry, I'm not seeing why the regions are not being displayed, but this last health region is actually Canaries, where we see a quite significant incidence in cases over the last 2 weeks. And with that, I will hand you over to Dr. Belmar-George, who will discuss in more detail the variants of concern.
Thank you very much, Dr. And just to give a quick summary in Creole, Noueki, Moun kilaj 25 l'année de l'âge, pour 49 l'année de l'âge, c'est moun nou ka wè ki ni pli mal COVID-19 à Saint Lucia, et puis l'autre l'âge nou ka wè c'est moun ki a ho 50 l'année de l'âge. So this is persons who are 12 to 49 years of age and also people who are 50 years and over. Also, she mentioned that when it comes to the areas in Saint Lucia where we have the most cases of COVID-19, we have Babono and Slurry Canaries. This would be Babono, Laslawe, Epikanawi. Right now, I turn to Dr. Sharon Belmar-George, who will speak on the variants. But I think in your presentation, it would be important to speak a little on the alpha variant, because for some people, they might not know what the alpha variant is. It's something that we've had in St. Lucia, is this variant. So you can also speak on that.
Okay, I will clarify that. Thank you very much, Ms. Neptune. Just to also make it very clear, the alpha variant, this is the variant we called the British variant. They've since removed the nationalities to the variants. And the Delta variant is the one which is known as the Indian variant. So these are the two variants of concern that we have confirmed in country to date. It is extremely important that we put the new context of having two variants of concern circulating in country and make it very clear what the implications are. So I will briefly go through what the variants of concern are. COVID-19, the SARS-CoV is a virus, and typically it's behaving like every other virus. They mutate, they form new viruses. Some of them have minor changes in their genetic makeup. We see with the influenza virus where every year there's a new, we need to have a new vaccine based on the and based on new strains. So according to the CDC, a variant of concern is identified as one where you get evidence of increasing transmissibility, more severe disease, increased hospitalizations or deaths, significant reduction in the treatments that are being used, sometimes the vaccination efficiency, reduced capacity for treatments, and sometimes diagnostic failures. So there are certain things you look at to see if a new strain is qualified to be a variant of concern. So you look at diagnostics, treatments, the effectivity of the vaccines, the decreased susceptibility to various treatments, increased transmissibility, like I said, and evidence of increased disease severity. So far, there have been 4 and then 5 variants of concern. This is a very wordy slide, but I will only pick out the more important notes out of it. The alpha variant, which is the British variant, we now have 54. We have now diagnosed 54 of those in country. It was first identified in September of 2020. And as of August 3rd, it is in at least 182 of all of the 6 WHO regions, and in 45 in the Americas, 29 in the Caribbean. Earlier in the year, they thought that it would have become the dominant strain by the middle of 2021. It's estimated to be between 24 to 70% more transmissible than the original strain with a higher viral load. Now, this was the strain which was circulating with the wave that we managed in January, February. If you note, our tallest wave to date has been January, February, when we did have the introduction of this alpha variant in country. And we saw the increased transmission over time. We saw the effect of the Alpha variant, where we got a lot more cases compared to the 2 other waves that we managed previously. The Alpha variant, which we had been managing, the vaccines are seen to be effective against it. After the second dose, the Pfizer 93% and the AstraZeneca 66% effective. I will go on to the Delta variant, which is the second variant which we have now diagnosed today in country. It was first diagnosed in 2020 in India, October of 2020 in India, and as of August 3rd, it is in at least 132 of all 6 of the WHO regions, and in at least 11 of the Caribbean islands. Yesterday, CARPHA informed us that 3 other Caribbean islands have been diagnosed with the Delta variant. So I guess Saint Lucia was one of them until we received those results. It forms more than 90% of the new cases that are seen in the UK and over 80% of the cases that are seen in the US and France. And it has become the dominant strain in at least 13 countries. So initially it was thought that the Alpha variant or the British variant would have been the more dominant strain, but the Delta variant, because of the level of transmissibility, has become the more dominant strain. And this, what is known about it of us, the increased transmissibility, so it's 97% compared to the other strain of virus. So imagine we were managing a 24 to 70% more transmissible. Now we have a 97% more transmissible with the Delta variant that we are managing now. It is known to cause more severe disease, hospitalization, as well as increased ICU admission and deaths. They note that the preliminary evidence suggests that the hospitalization rate for unvaccinated persons is a lot higher, and the Delta variant is known to have an estimated over 100 times the viral load of the regular strain of the SARS-CoV, and also a shorter time for exposure to infection compared to the regular strain. Now, we do have a definition as to what a contact is when we do contact tracing. It's based on the contact time with a positive case. Because of the viral load of the Delta variant, it means it takes a shorter time period in which you can become positive if you are in contact with someone who is positive. So it is a lot easier to spread, and it also spreads to a lot more persons. What is known in terms of the vaccine coverage? Vaccines are likely to be still effective, over 75% in controlling disease transmission, disease and death. I will also take the opportunity to clear up a misconception in relation to vaccination and variants of concern. The COVID-19 vaccine, as with the other vaccines, it protects you from severe disease, hospitalization, and death. There are breakthrough cases, so we do have persons, about 8% of our fully vaccinated persons we note could become positive with COVID-19. What we have seen in Saint Lucia is very similar to the rest of the world. Those persons get very mild and asymptomatic disease. So if you're vaccinated, you may get a very mild or asymptomatic disease. So we're not saying that 100% of persons don't get it. You can get it, but very, very mild. What we have noted in country with the AstraZeneca vaccine that we are using, it has protected. We have not had anyone who is fully vaccinated being hospitalized or died of COVID-19. So this is extremely important for persons to put the importance of vaccination in context. This is extremely important for us when we look at how, and we have to learn from everybody around us, when we look at the effect that the Delta variant has had, both in the international arena and also on the local stage. We just have to look next door to Martinique, and we all know what the health capacity of Martinique, the ICU capacity is probably more than most of the OECS countries combined. And they're managing the Delta variant at this point. happened with COVID-19 and the Delta variant, it has become a disease of unvaccinated persons. So they're seeing unvaccinated persons being hospitalized. They're seeing unvaccinated persons overwhelming the ICU. The ICU is at capacity, the hospital is at capacity. And to put it in context, the reality, when we look at the health situation of NIC being over, we have to use our capacity. Our respiratory hospital bed capacity is 123. We can bring it to a maximum of 130, squeezing in some more beds. It is extremely important at this point that whatever measures we have in place and that our population note the critical point that we cannot allow our health system to be overwhelmed. We have 123 beds within our respiratory hospital. We cannot allow our complicated cases, our cases that need hospital care, to come close to that number. And this is where we start getting increased deaths, probably not just from being COVID-19 positive, but the capacity of the health system to manage those numbers. So it is extremely important that we take this new information in context and that we ensure that every single one of us do the necessary. The Delta variant, I'm just going to zoom in a little bit. I speak of it earlier, that it's now the dominant variant in US, UK, France, and 11. So makes it 3 more as of yesterday. So now 14 countries in the region, and it can go up to 97% more transmissible. What is of concern for us with the Delta variant that we are seeing both in the international and on the regional stage, with the Alpha variant and the regular COVID strain, the target was more elderly and persons with chronic conditions. And I'm not trying to, it's okay for it to target them, but what I'm saying now, with the Delta variant, we see a younger age group being affected. We see a younger age group getting complications. And we are already at the respiratory hospital where we are getting younger persons. Some of them do not have chronic conditions. Some of them are healthy persons getting affected. And this is the effect of the Delta variant in most of the countries that it is impacting. It affects the unvaccinated persons more severely. This is being seen both in the region and internationally. So seeing for us, we still have 100% unvaccinated persons at our respiratory hospital. The rest of the region is seeing a similar trend. The vaccine efficiency, AstraZeneca, is still very effective. It protects against severe disease, complications, hospitalizations as well. And the Delta variant, it's also our therapeutics, that's our treatment, is also less effective against it. Our PCR testing, we are able to pick up COVID-19 in the Delta, but we're not able to do gene sequencing in Ireland. It also, the Delta variant causes an increased morbidity, that is sick persons with severe conditions, lung conditions, and also an increased mortality rate is noted with the Delta variant. So vaccination really is the key in terms of protecting us at this point, and our vaccination rate, we are not on target for our vaccination rate according to our national plan. So being closer to 70%. I also need to indicate that what they've noted with the Delta variant, to be able to get to herd immunity, is a lot higher. Yesterday, Dr. St. John indicated that herd immunity is closer to 90-something% as compared to what we were working with as 70%. So for us to feel protected with the Delta variant circulating in country, we would need to be closer to the 90s as compared to the 70s that we were working with in our national immunization plan. My colleague will be discussing the immunization manager vaccination, but I just wanted to alert the public. I think we are aware that The policy is not to mandate vaccination at this point. We will be hosting a national conference to ensure that there is discussion, dialogue, consultation in relation to vaccinations. We will be having presentations both by the health team and by the legal minds. The legal fraternity will comprise Professor Rosemary Bell Antoine, Sir Charles Michael Dennis Aaron, Mr. Rene Williams, as well from the Attorney General's, he's a senior counsel from the Attorney General's office. Presentations by health will be done by myself, Dr. Stephen King, and our immunization manager, Nurse Tekla Jabatis. This consultation will be held on the 19th of August at 4 p.m. via Zoom. This will be shared with all stakeholders. We want everybody to listen to the various implications, and we want all voices to be heard at this consultation. We are looking to include all stakeholders within the discussion. Thank you very much, Ms. Neptune.
Thank you very much, Dr. Belma. Before I give the quick summary, perhaps you can explain viral load, because we use the term viral load, but for some Saint Lucians, they might not understand what is viral load, and also transmissibility. We know that it means in terms of the passage of the virus from one person to another. If you can explain this first, please.
So viral load is basically the amount of the virus that is in the secretions. So the more of the virus that is present in whatever secretions it is, in the case of COVID-19 would be nasal or nasopharyngeal secretions, the more likely it is to be transmitted, be communicated, or to one person, from one person to the other. So when we speak of viral load, we speak of the concentration of the virus within any of our secretions, blood, nasal secretions, etc.
Thank you. So just to give a quick summary in Creole, Dr. Belma spoke on that variant. AP variant nefsala, yuka kuye delta, nouwe ki, nou ka jwen ika sime pli. So, kay jwen pli moun ki kay ni maladi COVID-19 epi delta, piski delta ka si may pli vitman. Aussi, nou kay we pli moun ki kay wive l'hopital epi pli moun ki kay mo epi zafe variant la. Epi, sa nou ka we aussi se ki poko jwen la vaccine la, aussi se moun sa ki ka affecté pa Delta variant là. Et puis aussi nous ouais ça ces jeunes monde là, et puis c'est pour raison ça là nous encourager monde, encourager ces jeunes monde là pour prendre la vaccine là. I call on Nurse Tekla Jabatis to give us a vaccination update.
Thank you, Ms. Neptune. Good morning. We know that ending the COVID-19 pandemic rests partly on a large uptick of the COVID-19 vaccine, of course, with the goal, with our goal to reach population immunity. Of course, we started off with 70%, and now we're hearing from our chief medical officer, taking into consideration the Delta variant, we should be something like 90%. So I will provide you with an update of our COVID-19 vaccine implementation. So the slides, please. Next slide. This slide here just gives us a brief overview of our COVID-19 vaccine implementation. It's about 6 months, 5 to 6 months since the implementation of the COVID vaccine in Saint Lucia. We launched, of course, in February of 2001. And since the launching, of course, we know that the vaccine campaign has transitioned from its initial phased approach where we targeted persons based on their risk of COVID-19. We transitioned from that to the general population with the inclusion of other strategies. We included mobile component, of course, we had pop-up vaccination sites, and we continue to have targeted approach, targeted intervention at various workplaces, at hotels, in the commercial sector, and in the communities. We do recognize that we have persons with mobility issues, and our teams are still on the ground, reaching out in the communities to persons who would require the vaccine or would like to have the vaccine, really focusing on persons who are at high risk. Where are we now? We're in August. As of yesterday, we would have administered 33,474 first doses of the vaccine. This accounts for 18.5% of the population being partially vaccinated. 26,162 persons are fully vaccinated in Saint Lucia. They would have received both doses of the vaccine, and this accounts for 14.4% of the population. This tells us that we are still very far away from the population immunity that we are aiming to achieve. At this point, we continue to intensify our community outreaches and, of course, to re-strategize our campaign to include other components. Next slide. This slide here just gives us a snapshot of what our vaccination uptake has been, and it is presented to you by weeks. So we see when we started off in February in week 1, and how we picked at about week 4, which was the end of mid-March thereabout, with the first dose. And of course, we see a steady decline in the uptake of the first dose. We see a sort of a similar pattern once we would have introduced our second dose, when persons would have, our first set of persons would have been due for their second doses. So we see a sort of a similar pattern. Of course, we note that the total number of persons who had received their second dose in comparison to those who would have received their first dose, we see the difference. So obviously, this tells us that you still have some persons who would have received their first dose of the vaccine who have not turned out for their second dose of the vaccine. And this pattern continues. Right down, we noted a very steady decline, and it stayed down. You know, the uptake has been really, really, really low. But somewhere around week 21, week 22, when our protocols would have sort of changed and there was opening of activities and opening of, you know, other social activities, etc., and travel and all that sort of thing, then here, and persons, of course, would have been, I mean, in order to be able to travel, to be able to socialize, to attend events, persons would have required to be fully vaccinated. Then we started noting a very slow increase in the uptake of the vaccine. The slide before that. Okay. So again, this slide here just really gives us tells us the same thing, but just showing us that what the uptake has been by months. Next slide, please. So as we look at this slide here, we see the uptake by our age groups. And Dr. Francois would have alluded to this, but again, I just want to re-emphasize that we see the highest uptake in our persons 50 years and older, followed by those who are 25 to 49. And of course, if you look at the difference between that and the lowest uptake, which is our younger population, persons 18 to 24, you see how significant it is. So of course, our re-strategized campaign is really going to be geared and focused towards the younger population. I mean, there's still a big portion of the population who fall within the other age categories, who we expect to turn up for vaccines, because what we want is to achieve that 70%, but we really want to focus and we really want to encourage the younger age groups to get vaccinated. Next slide. This slide here just gives us a snapshot by districts in terms of our vaccine administration, our uptake. So of course we see that the highest uptake is in the more densely populated parts of the island. Castries with 35%, Grosselet with 27%, and we have Beaufort with 10%, and the other area, the other districts, ranging from about 1% to about 7%. Next slide. So this is our current situation. I would have alluded to the percentage of the population that have been fully vaccinated. Of course, the trends, I will say again, for the past 2 months, we have seen a very slow increase in the uptake, particularly in the first dose. Vaccine hesitancy, of course, continues to be a major challenge, and this can be attributed, of course, to some safety issues. We know once it was announced about the blood clot issues surrounding the AstraZeneca vaccine. This is when we noted the dip in the uptake of the vaccine. But again, I will just re-emphasize that the risks for developing clots from a COVID-19 vaccine is so small as compared to the risk of developing clots from COVID-19 infection itself. Of course, we know all of the conspiracy theories, and we know about persons having concerns about how fast the vaccine was developed, and we know these are some of the things that continue to affect the acceptance and the increased uptake of the vaccine. So this is the reason why we continue to educate, and will be really intensifying our campaign strategy and our public education, so that persons are provided with the necessary information so that they can see the importance of the vaccine and, of course, make informed decisions to protect themselves, their loved ones, and those around them. CMO would have spoken about our situation at the respiratory hospital. We see that severely ill persons admitted to the hospital, most of the severely affected ones are unvaccinated. And she did speak about the 8% of the positive cases who have been vaccinated, or they were asymptomatic. And now, of course, we have the variants of concern to deal with. We knew that we had alpha variant circulating. Now we have the highly transmissible Delta variant that we have to deal with. So what is our way forward? Of course, there need to be increased availability of vaccines. Currently, you know that the only vaccine that we have been using is the AstraZeneca vaccine. And I must say that the plans to access and procure other vaccines is in progress. And I have to announce that Saint Lucia is due to receive a donation of Pfizer vaccines next week. So from next week, we would have an added vaccine as part of our COVID-19 vaccination program. Now, giving our people a choice as to which vaccine that they would want. As I would have alluded to earlier in my discussions of our strengthened campaign strategy, we will be intensifying the community outreach component of the campaign, and of course, expand the access to vaccines by engaging more private sector health institutions, physicians, and pharmacies. At our last press conference, we had just launched, we had just engaged one pharmacy as a public-private partnership, you know, to offer vaccines, and I have to say that this is doing very well. The response is very good, and as such, we are exploring and we will be extending to other pharmacies. Our communication strategy, of course, very, very important. And in intensifying that and strengthening that, we will be including a component of behavior change communication in our campaign. I will just take this opportunity actually to just give some very brief information on the Pfizer vaccine, since this is going to be the newest kid on the block, right? As of once we receive next week. So I think whilst our communication team and the immunization team will be educating the public and will be giving all the necessary information, but I think this is an opportunity for me to set the stage. So we know that the Pfizer vaccine is a messenger RNA vaccine against COVID-19. It is a 2-dose regime given 21 to 28 days apart, and it confers about 95% protection 7 days post its dose 2 against symptomatic SARS-CoV infection in persons aged, well, that was information from the trials, 16 and older. Its effectiveness, from 7 days after its second dose, for documented infection is 92%. For symptomatic COVID-19, it is 94%. Hospitalization, 87%. And against severe disease, 92%. Based on the recommendations from the World Health Organization and the SAGE, the experts on immunization, the Pfizer vaccine is intended for use in persons 12 years and above. So our younger population, so now our eligible population would have been a lot larger than what we are actually working now. So more persons would be eligible to have the Pfizer vaccine. It is, I think I said that, it is 2 doses given intramuscularly into the deltoid muscle. As it really, well, CMO would have touched a bit on that, but just to say that, you know, the variants, especially the Delta variant, is, you know, have higher transmissibility, disease severity, the risk of infection is high, and there can be a change in the antigenic composition resulting in lower vaccination effectiveness. This is the variant. So preliminary data, has shown some reduction in the neutralization activity of the vaccine against some of the variants, and that also includes the Delta variant. But of course, the vaccine is still very effective against it. So here, my key message is just to re-emphasize that vaccines continue to play a critical role in providing that added level of protection, preventing deaths and hospitalization from the severe form of infectious diseases. Variants such as the Delta variant, of course, we know it spread faster than earlier forms of the virus that causes COVID-19, and of course, they cause more severe illness than previous strains in unvaccinated people. When CMO presented, we see that we've seen, and she alluded to the fact that we've seen that, you know, the Delta variant has become a disease of the unvaccinated persons. So that being said, we just want to encourage persons to, you know, continue adhering to the protocols and ensure that you access vaccines, you get vaccinated to protect yourself from the complications that this variant or can have on you. And so we need to encourage, I am encouraging persons to continue wearing indoors and in public places to reduce the spread of COVID-19. Thank you, Ms. Fennell.
Thank you very much, Ms. Jean-Baptiste. Nous qui en haut 3,000 moun en cette ici j'ai joint première dose la vaccine là et puis en haut 26 moun j'ai joint deuxième dose vaccine là et puis ça c'est pour AstraZeneca. Et j'en ai 6 mois depuis nous commencer le programme la vaccine ici et puis les venu pour statistics nous qui un monde qui 18 l'année de l'âge pour 24 l'année de l'âge, nous avons 8% de la population qui a joué la vaccine là. Les venu pour monde qui 25 l'année de l'âge, pour 49 l'année de l'âge, nous avons 43% de la population qui a joué la vaccine là. Et puis pour monde qui a 50 l'année de l'âge, l'année 49% de la population. Ça nous a qui moun qui a 50 l'année de l'âge, c'est moun ça là qui j'appli aller dehors et puis joindre la vaccine ça là. When we look at the uptick by area, just to recap, we have the highest area being Castries, and that is with 35%. So this is 35% moun Castries qui a joint la vaccine là. And we want to reiterate again that the Ministry of Health has noted that more of the persons who are at the hospital with the severe form of the disease is mostly persons who are unvaccinated. So again, we're encouraging people to get vaccinated. And just to touch on quickly, Saint Lucia will be the Pfizer vaccine. Saint Lucia will vaccine, la vaccine Pfizer semaine prochaine. Et puis, nous n'y pouvons point 2 doses vaccine ça là. Et au cas point deuxième dose là après 21 jours. Vaccine Pfizer qui est available pour moun qui 12 l'année de l'âge. So again, the vaccine will be available for people who are from 12 years of age. Before we take a few questions from the media, I just want to note that the Minister for Health, the Honorable Moses Jean-Baptiste, will be making a statement on the new variants that we have in Saint Lucia. So this statement will be provided later today. Now we will take a few questions from the media. We ask that they come to the front to ask the question and also state your name and what organization you will be representing.
Okay, Nelsia Shalmang, Choice TV. My question is regarding the Delta variant. It was stated that the 3 cases are U.S. nationals, but where would they locate? I mean, where were they discovered? Had they been in country? Were they vaccinated? Had they been in hotels and mingling with the patient?
Okay, to clarify, the 3 Delta variants, 2 are from the U.S. and 1 is a national. Of the 3, only 1 vaccinated with the Pfizer vaccine. Locations. 2 of them are in the south of the island and 1 from the north.
Good afternoon, panel. Solaj Alfred, HDS. My question is also in regards to the Delta variant. We understand that the visitors, non-nationals and nationals who are vaccinated are allowed to come in without being quarantined. Given that we now have a non-national who was vaccinated coming in, are we going to backtrack in any way to revise that protocol in regards to non-quarantining of vaccinated persons?
Thank you. That's a very good question. Remember earlier that being fully vaccinated does not prevent you from getting COVID-19. In some countries, based on the vaccine that they can, we see from 15%, 10%, 5% of persons get what we call breakthrough infection, where you're fully vaccinated and you can get COVID-19. So there is a risk of someone who's fully vaccinated who can still get the disease, but we have a number of layers of protection. One is the request for a pre-test before arrival into country. Now, there is still a possibility that during travel that you can develop or come into contact with a positive person and develop COVID-19. So there is still that risk of you coming in and spread. To date, we've not been, the information on what is the level of transmissibility of a fully vaccinated person, this is not being qualified as yet. We know it is less because in someone who's fully vaccinated who develops COVID-19, the viral load, like Dr. Francois explained what the viral load is, the quantity of the virus is a lot low. So given a fully vaccinated person develops a milder form of a disease with a lower viral load, the possibility for transmission is a lot less. Those persons tend to be asymptomatic or very, very mild symptoms. So that reduces the level of transmission to other persons. For the cases that we have in the country coming in, most persons need to leave countries. Although we have noted positive cases for persons coming in, we have not managed any outbreaks or transmission from those persons. So when we test those around them, when we test those who work with them, we have not had any outbreaks coming from those persons. So it is something which was flagged before the decision. It was part of the discussion that there is that small percentage of persons who are fully vaccinated who develop breakthrough disease. The risk was known. The level of the risk was not clear because this has since not been quantified by the research. Based on the trends and the new cases that we have seen, we have scheduled meetings next week with quite a few of our stakeholders where we see a level of risk. On Monday, we're meeting with the minibus association because this is another group that is of concern to us. We know the present protocol allows 3 persons per seat, and we need every single person to take personal responsibility. You don't put your health at risk being squashed in a minibus full of persons. So we are going to meet with the sector on Monday to discuss compliance, all of the sanitary measures, the public health measures, the use of the face mask, and to ensure that they work with us. We need every single stakeholder to work with us at this time. On Tuesday, we're scheduled to meet with the hotel and tourism managers as well, because we are at a very critical point where we have to reduce every single risk as much as possible. So enforcement of all of the public health protocols in every single sector is extremely important at this point. So we will be meeting with those on Tuesday, and we also plan to meet with the chamber and the business community on Wednesday as well, because we notice a relative relaxation of the measures. We are in a critical place. We have to look at every single service that is open at this time, because we have to, as much as possible, reduce the risk given the level of transmission we are seeing and that we were already seeing in the last 2 weeks. So it is one of the things that is going to be discussed as well, looking at the level of risk. And with our phase reopening, at every sector, we look at the risk and we look at what the country's capacity is based on our 20 health indicators. One of the indicators which we are monitoring closely is our hospital admission. During the month of July, we had on average 8 admitted persons. We've already seen it has increased to 18 in the month of August, and we are halfway. So we're monitoring closely. At no point can we allow the number of sick persons to surpass our capacity to manage. So with every phase, with every service that's open, there's always a risk of transmission, but it is what we do within the system to strengthen and to mitigate that possible risk. Thank you.
Okay, I have a follow-up question. The 2 U.S. nationals, were they detected at the border entering Saint Lucia or somewhere else?
Somewhere else.
Can you tell us?
No,
where?
I don't think I should name facilities at this point.
Okay. People are asking if you've received your first dose of AstraZeneca and you're waiting for your second dose. Now that we're getting the Pfizer vaccine, can your second dose be a Pfizer shot? And some people are also wondering whether they could get a top-up even after being fully vaccinated with AstraZeneca. So if you could provide some clarity on that.
I will allow our immunization manager to discuss what our vaccine policy in relation to that is.
Thank you, Sable. Good question, Michelle. Yes. So our vaccine policy remains a complete regime in a particular vaccine. We do know about the mix and match and the heterologous combinations of vaccines that some countries have been doing. But our vaccine policy remains one vaccine, one type of vaccine, the complete regime. However, there is consideration for mix and match. I'll just stay away from the big word, but the mix and match. There is consideration, especially down the line. We're not sure because we know vaccine logistics, sometimes things change. We may just have a delay of a vaccine, of a shipment of vaccine, and persons may be due for their AstraZeneca. And Pfizer may be the only thing that is available at that time. I'm just putting this forward as a possible situation, given what we know about our shipping, etc. Yes, that is a consideration, and that is something that we would consider. WHO has given some approval to this, for the consideration of heterologous combinations. However, as long as the vaccine is available, we would stick to our vaccine policy, which is a complete regime in a particular vaccine.
And is there ever a need for a third dose?
For now, no, the evidence, we have no evidence, or there's no recommendation for a booster dose.
Okay.
Yeah.
My next question is in relation to signs and symptoms. Our focus generally for the last year and a half has been a lot on respiratory symptoms, and if you're showing these sorts of respiratory symptoms, you should probably get tested. But based on anecdotal stories, a lot of people have experienced gastrointestinal symptoms. So is that something people should be looking out for as a sign that, okay, maybe I may have COVID?
Thank you very much for that question. Very, very important question, and I'm happy to address. Earlier on in the outbreak, we did notice a few individuals presenting with gastrointestinal vomiting and diarrhea, etc., and were tested and did come out positive for COVID-19. In the last few cases that we have noted, through contact tracing, and these are preliminary results because, as you know, we had a very large number yesterday. Calls are still being made, as well as to those for today. We did note that families, entire families, were reporting gastrointestinal signs and symptoms. So that is something definitely that the public needs to be aware of and they need to look out for. At a hospital level, they have also noted that persons are complaining or presenting with headaches and dizziness. So they're in addition to the loss of smell and taste that we were seeing previously. So there are neurological symptoms that we now need to start paying close attention to. Dr. Belma pointed out that we are also seeing younger persons being hospitalized. And so persons need to bear in mind that we're not looking only to the elderly or the older persons for severe illness, although we have noted that, but it is changing. And we know that there are several variants of concern. We now have 2 in 3. Presentation, the emergence of new variants of concern. This changes a lot in the dynamics, the clinical picture, the management, etc. of COVID-19. It is a very fluid situation. What we have noted also that there is labs perspective, there is a significant increase in viral load among the samples that we are receiving and also in younger persons. And of course, we mentioned that the Delta variant is a lot more transmissible. So we're seeing evidence that we may have more, obviously, more than what we had sent to CARPHA for genotyping. So that is something that we need to pay very, very close attention. And also in the last 2 weeks, the cases that we have received, preliminary data that we got from this, 9% of these, only 9% of these were fully vaccinated. So we need at all levels to be pushing vaccination to ensuring that we protect ourselves and that we protect our families if we are to go anywhere in this COVID-19 battle. Thank you.
Okay. Just a question I'm getting from one of the media representatives, Pitnin Val. He wanted to clarify again the number of Delta variants that we actually declared today. And just to clarify, we have three cases of the Delta variant, and that is 2 U.S. nationals and 1 Saint Lucian.
Primus Hutchinson, Government Information Service and the National Television Network, NTN. My question may appear a bit simplistic, but I believe it is important. The emphasis is on being fully vaccinated to effectively combat the new variants. So how protected are those who continue to observe the protocols, face masks, sanitizer, and so on, but they are not vaccinated? How protected are they? I mean, they're not vaccinated, but they continue to observe the protocols. Is the new variant? The
new variant, okay. Given the high level, like I said, up to 97% more transmissible that the Delta virus could be, given the high level of transmission possible, it means someone who's in contact with another person, it takes a very short period of time for the virus to be transferred from one person to the other. So it would mean that our public health measures have to be maintained in the most strict way possible. Use masks, staying away from crowds, keeping a distance from everybody. We are at a point where we need to treat everybody else like they're positive for COVID-19. So it provides one level of protection, and this is one of the reasons why we have indicated that even if you are fully vaccinated, you continue to use the face mask, you continue to wash your hands regularly, use of hand sanitizers, surfaces clean. So just observing the public health measures, it is not enough at the stage that we are. The severity of the Delta variant, like those Jamatis indicated, the way that we secure our population, we have to get to as high a immunization as possible if we are to reduce the impact at this point. We are at the most critical point. A lot of sacrifices needed over the next 2 weeks. We need to break the transmission rate that we are seeing within our communities. So saying you won't take the vaccine and just use your mask is not enough. It's not enough as well. And also given we will be getting the Pfizer vaccine, so we will ensure that the 12 plus will now be covered, which is of concern to all of us who have kids. We want our kids covered. This is very good, this extra level of protection. But we haven't below 12 that there's no vaccine has been cleared as yet for. So as much of the 12 plus population, we need to try to protect them. The Delta variant, it affects younger ages. We are seeing younger persons being admitted to the hospital.
Okay, understood. Ms. Shabatas, I think you indicated earlier on that one has a choice with the new vaccine, the Pfizer, and well, of course, people are a little more, they have been exposed to the AstraZeneca. We're just getting into the Pfizer.
Pfizer.
So how do one make a choice in that regard? I mean, how do you direct one as to what he or she should do as far as administering the Pfizer against the AstraZeneca? So.
Well, yes, thanks for that question, Primus, and it is a valid one, and I'm sure you're probably not the only one. We do recognize that, like we did ahead of AstraZeneca, the introduction of AstraZeneca, we had quite a bit of public education. The vaccine is going to be here. I mean, we have been planning the logistics, and it has been confirmed that we would be getting it. So now our next step is to intensify our public education.
Before it's been administered?
I beg your pardon?
Before it's been administered.
Well, I mean, some persons have been doing it. We know persons have been doing their reading. Trust me, they are. But we will be providing public education. So there will be presence of our team in the media. We will be doing the discussions on the ground. We will have circulation of elimination of flyers, brochures, etc., giving persons information about the vaccine so that they could make the informed choice. Of course, we know the healthcare providers on the ground are always available to clarify any misconceptions or any myths surrounding the vaccine and to provide our populace with the information that they require to make that informed decision. And of course, CMO mentioned about the consultation that is going to be happening next week, and we will be also touching on that during that consultation.
Of course. Thank you so much, Nurse. Let me engage my colleague here that she can at least enlighten our viewers in Creole regarding the question. Expliquez-moi, s'il vous plaît, si ou vacciné, ou pas pour la vaccine, ok? Et mais ou qu'a servi masque, qu'a servi tous ces protocoles-là, qui manière qui capte protection ni contre ces variants neuf-là? Est-ce que servir masque seulement, eh bien, sanitizer, ça protège ou sous pas la vaccine, sous pas pour la vaccine?
Merci.
Okay.
Moi, quand je fais ça bien vite, nous chef officier médical, Dr. Charles George, parlait à ça. Et puis, parlait de même si on a fait bagaille pour protéger le corps, comme servir masque, pour distance l'autre monde, il est aussi important pour la vaccine là. Puisque la vaccine là, qui protège le virus, aussi, il protège maladie Covid. Et puis, nous, et puis maladie Covid et puis variant là, nous avons si mais plus vite aussi, nous avons ça une cause moun joindre plus mauvais forme de maladie COVID-19 aussi moun sa mort COVID-19 pour servir masque pour distance moun et puis là nous dit servir masque nous voulons moun servir pour couvrir fidjayou couvert nez couvert maton aussi nous avons dit moun pour laver la main et puis savon et puis glou aussi ça servi hand sanitizer et puis toutes ces bagages ça très important et puis parler dit yo kay serve yo kay ni meeting et puis différents stakeholders qui ka venir pour qui manière yo ça aider yo mettre ces qualité protocole ça en place les venir pour bagages comme bus ça nous ka créer transport les monde ka voyager ça est important et puis toutes ces bagages c'est important c'est pour nous protéger contre la maladie COVID-19.
We've seen the push to get the Pfizer vaccine as well as the AstraZeneca. Will there be any drive to also secure the Cuban vaccine as well?
Thanks, Solange. As you know, for us, in the area of health, we introduce vaccines that have been pre-qualified for use by the World Health Organization. So we depend on the World Health Organization for their pre-qualifications, because in Saint Lucia, we do not have regulatory authorities. And basically for the region, we depend on the approvals from the World Health Organization. The Cuban vaccine, we have noted, based on its trials and reports of its efficacy, that it has been reported that it produces a high level of efficacy, effectiveness. It is effective against the COVID-19 vaccine. I have said this before, and I'm sure the colleagues have. We are very open to the Cuban vaccine, but until it has been approved by the World Health Organization, the Cuban vaccine, Abdallah, is still in its third phase of trials and has not been pre-qualified for use by World Health Organization, and as such, we would not introduce it to our population just yet. But we await, and once it has been pre-qualified, we are open, because we do note that there's a significant percentage of the population who are eagerly waiting for, for the vaccine, the Cuban vaccine, to be available.
I just want to clear up a misconception that we hear a lot of. Like Najbati said, the policy for us in the region for introducing vaccines is the regulatory authority of the WHO. Every region has a different regulatory authority. So for us, in the region of the Americas, the European region has a different regulatory authority, as well as the US and the African region. For Saint Lucia, the authority who gives clearance on vaccines, our vaccines, through the PAHO WHO revolving fund. The clearance for the region is WHO. The FDA is not an authority for vaccines in our region. The vaccines we've taken as children, the vaccines we've given our children, not approved by the FDA. It's not their role. We do not apply to the FDA for approval. So it's not that the FDA does not approve it, does not apply to the FDA for approval. It is not the regulatory authority for vaccine in the region. So we keep seeing that the FDA has not approved the COVID vaccine. It's not their place to. The region does not apply to the FDA for approval of vaccines. Our regulatory authority for vaccines, it's the WHO. So the vaccines we took and that we are giving our children are WHO approved. They're not FDA approved. So it's being put out of context, and we see a lot of it happening. So I think it was necessary to, the same way for Europe, for the US, they have their own regulatory authority approving the vaccines for use. And the Ministry of Health, we've been recommending that any vaccine that is approved, we keep to that standard. We would not, there would be legal and ethical issues on taking up a vaccine. We had a very good consultation with some of the other stakeholders, like the Rastafarian community, and we know they are looking forward to the Cuban. We made the initial arrangements. So once that level of approval is there, we would like to get it. We are also going to be getting the Johnson & Johnson vaccine. We're going to be getting 30,000 doses as well later on. So we are looking to see how we could have, we've heard the cry of the public that they don't just want the AstraZeneca. People want a choice. And we are really trying to give them the choice so we can get to a safe measure. So we are getting the Pfizer next week. We are going to be getting 30,000 of the Johnson & Johnson, which is a 1 dose. And we have already made the arrange as soon as the Cuban vaccine gets cleared, that we get it and make it available to the public. Because we know people want a choice, and if it's going to improve our coverage, we are working towards making it happen.
Thank you for that, CMO. Still on the vaccine, I think, I just wanted to point out that persons are saying that what is the incentive for the vaccinated versus the unvaccinated, because you do get vaccinated and then you're basically put in the same restrictions or the same protocols as those who are unvaccinated, and that's leading to some of that hesitancy. I know there's the national consultation meeting on the mandatory. Will any discussions be centered around incentivization for the vaccinated individuals?
Yeah, that is going to come up as well within the consultation. I want to say the biggest incentive for taking the vaccine is staying alive. My fear, and people who know me, I don't do nothing. To get COVID and to be somewhere doing nothing will be a big problem for me. So getting the vaccine so I'm not hospitalized, and when you're sick, that it's difficult, it's high risk to have you next to somebody else, especially if you get as sick as we are seeing our unvaccinated persons. We are working to see how we make it easier in terms of people leaving the rooms at the Victoria Hospital. We know it's hard to be isolated alone. The fear of being at a hospital where you are alone, where you're very sick because of the risk of the transmission of the virus. So the incentive is not getting very sick, not being hospitalized, and not dying of COVID. To me, this is the most important incentive for taking the vaccine, for me. Now, for us to be able to freely continue the phase reopening, the opening of the country, there were 5 levels, and within 5, there were a number of subsections. Within number 5, what we were moving on to was the opening up of events. To safely, and events, because they're mass crowd in nature, they pose a higher risk. For us to be able to safely move to that level, we need a large percentage of the population to be covered. If we were at 90-something, close to 100, knowing that most persons, if they do get the vaccine, the viral load, that is the amount of the virus that they have, would be low, a lot of the public health measures, it would be a lot easier to reduce them because the overall risk of the population would be less. So if we were to get to a high enough vaccine level, it would be so much easier because the risk to other persons would be less. So a lot of things, as we move around, are dependent on us. We need to get to that level so that we can safely do a lot of other measures and continue. We have to learn to live with COVID. It's a reality. We thought it would have been gone. It's not. Some of the incentives which we had put in place were the fully vaccinated activities and parties up to 150. We've suspended them for the period 13th to the 31st because of the high rate of increase we were noting. Once we can get back to a safe place, we want to continue with those fully vaccinated activities, fully vaccinated sporting events. And the other incentive as well is that you don't quarantine when you come in and you're fully vaccinated. So for travel and for most places, once you're fully vaccinated, then you don't need to. But we need to take a look and look at what is our priority at this point. It has to be health and safety. It has to be health and safety for ourselves, our family, and those around us. We need to look at what is happening around the world and do what is right. The critical point that we can't ask for too much now. Health and safety has to be the priority at this point.
My final question is twofold. One, when we get to that point of allowing for the vaccinated to enjoy some of those incentives like the 150-person parties, how do we track or how do we ensure that it's actually vaccinated individuals coming to these events? And the second one is, I know you mentioned the 123 bed capacity, but what is our tipping point? What is the red line when we say, this is really, really bad and this is a crisis? Not minimizing where we are now, but what is that point where we say this is absolutely a crisis?
Okay, your first question on the vaccines, I guess you are going into vaccine passport. At present, we're using the vaccine card. We've noted a lot of persons have falsified that vaccine card. We are working with the GGov to finalize the electronic passport. So from the 23rd of August, the electronic passport will be available. There'll be an application process through our website to have persons get the electronic passport, which would be more difficult to falsify. We have also been working with Saint Lucia, and we finalized the plan through a third party of an events card. Now, this is supposed to be launched next week, so I don't want to go too much into it. There'll be an events card, which is a one-time card which fully vaccinated persons apply for, and that card will give you the authority to purchase events tickets. So you must have that, and it won't be easy to falsify. It will be from our data, our information. So this information will come out next week. I don't want to preempt too much, but there is a process which would allow only persons truly vaccinated to be able to access events safely. Do you want to speak of the hospital indicators?
Okay, she also asked a second part in terms of the burden on the healthcare system.
I think, yeah. Want to speak?
So in terms of the tip, as you put it, we track several indicators. One of these indicators is not just the hospital capacity. Are looking at least 50% of the total capacity at the hospital at present. And at the hospital, we have persons who are considered suspect cases, as well as the confirmed cases. So we're going to monitor both the general admission at the hospital, so that gives us an idea of the number of cases with respiratory signs and symptoms that we are seeing in country that require hospitalization, and as well as the COVID, the number of admissions due to COVID. So we're looking at a 50% capacity, hospital capacity at this point in time. And when we are approaching that number, that is the indication to us that our system is becoming overwhelmed, because we have HR limitations and we try to address. But what we do not want is a situation at any of our hospitals whereby we have staff to go in between suspect and confirmed cases. So we need to keep this at a level whereby we can keep the patient and the staff safe.
We at our capacity for admissions, we are 28.
No, the last one, I think we're at about 30%.
Okay, 28 of 120.
Between 28 to 30%.
Yeah.
Karim Nelson, Hot 7 TV. My question is, the larger percentage of the population is unvaccinated. Earlier, you guys termed it the variant of the unvaccinated. So with that being said, what kind of situation now, and how prepared are we currently to contain with such low vaccination levels?
Saint Lucia is at a critical point with our 14% vaccination coverage and getting confirmation of the Delta variant in country. The transmission rate, we've noted the increase. We've also noted an increase in a few of our public health indicators that we monitor, one of them being hospital admissions. As we went from July having on average 8 admitted persons to now 18 on average at the respiratory hospital. We are at a critical point, like I indicated, and this is one of the reasons we looked at our data from the contact tracing process for the 497 cases that we've had and a little before. And we saw where the majority of both the index and the secondary cases were coming from. So this is the point where we appeal to everyone to take personal responsibility, every stakeholder. We urgently need to break the chain of transmission. If we are to continue along the path that we saw in the last 2 weeks, this wave will continue both into August and into September. The Ministry of Health, what we really want to do, we want to arrest the rate of transmission, reduce the number of cases in anticipation of the safe reopening of school in September. So we are at high risk given the percentage of a population that is not vaccinated. It is also critical, the adherence of the public health protocols. We cannot have any more mass crowd activities at this point. We have to reduce transmission. We have to the numbers. So we are really appealing to everybody to play their part in terms of reducing transmission transmission at the various services?
Just let me, Solange, sorry, my computer died, so let me just give you the actual figures. So in terms of the hospitalization at the respiratory hospital, we aim to be below 50%, and we're currently at 33. In terms of hospitalizations due to COVID-19, we are aiming for below 10%, and we're currently at 12.2. So it is a situation that we are monitoring, that we get updates on a daily basis from the hospital. So by the time we receive an update today, the numbers may change. But it is something that we are paying close attention to guide us in terms of how strict our restrictions should be, and when we need to release our restrictions.
Okay. Thank you very much. We no longer have any more questions from the media. Before we close, I would like the Chief Medical Officer, Dr. Sharon Belma-George, to give us some brief closing remarks.
Thank you very much, Ms. Neptune. I would like to conclude indicating that we are noting the increase in cases. We've had 497 over the last 14 days. Just as we had suspected with Delta variant in country, which is noted for increased transmissibility, more severe disease, increased hospitalizations as well. Given our low rate of immunization of 14%, we are really appealing to the public for personal responsibility in prevention of getting the COVID-19, ensuring that all of the public health measures, which I think everyone knows by now in terms of hand washing and use of hand sanitizer, use of a face mask in public, avoiding public places. And this is, we are at a point where we need every single sector, every community leader, the media houses, the minibus association, the commercial sector, every single sector, we need a level of vigilance, we need a level of compliance, we need a level of adherence. It's extremely important we keep ourselves safe and we keep our population safe. There are limitations within our healthcare system. We have planned for this increase. We are managing the increase, but we really need to reduce the impact. And we are once again appealing to the public on the importance of immunization. We are increasing, next week, we are going to be increasing the information on immunization. We continue with our vaccine sites. I don't know if nurse indicated the vaccines are also available at wellness centers, so it's available at the level of the communities, in addition to the sites that we have been advertising. I just want to acknowledge that, and I want to thank one of the stakeholders that has been working closely with us on improving on our vaccination levels. I want to acknowledge the tourism enhancement, the tourism sector. They were responsible for providing our first ultra-cold freezer storage. They ordered it. It was funded through the Tourism Enhancement Fund. I think everybody knows that we did not have capacity initially for the Pfizer vaccine. We've since ordered 3 such freezers, and the first one was funded through the Tourism Enhancement Fund, which we already have on island in preparation for receiving the Pfizer vaccine. So I want to acknowledge and thank them for the generosity of assisting the health sector during this time. So,
thank you very much. Just to point out that we'll be receiving the Pfizer vaccine next week. So we will be providing more information sometime next week in terms of the arrival, the exact date of arrival, and more information in terms of when it will be available, how can persons access those vaccines. So just please stay tuned to that, to our Facebook page, and also updates from the Ministry of Health on the Pfizer vaccine. Before we close, I should just give a quick summary. Nous voulons encourager, nous, en ministère de santé, voulons encourager Saint Lucia pour prendre la vaccine là, pour protéger corps, famille, gens et puis tout l'autre monde de maladie COVID-19. Ça est water et aussi nous camade pour continuer servir masse, continuer laver la main, continuer sanitize. Toutes ces bagages c'est important et puis aussi pour prendre distance de l'autre monde pour nous protéger contre nos maladie ça là. Et puis nous voulons remercier pour temps et puis nous. Well, I would like panel for providing us with such valuable information on the COVID-19 situation in Saint Lucia. It was definitely a pleasure. Thank you so much. On behalf of the entire production team at GIS NTN, I am Funel Neptune. Thanks for watching.